Now to our top story tonight, a problem that appears to be getting worse. Dozens of people died from opiate overdoses just in 2 months into the new year. There is some good news that local medical professionals are considering optimistic in the fight against the opioid epidemic. News 4's Dave Graber reports on how China could help our community save lives. Dave?
Yeah, Nalina, cautiously optimistic, certainly. Health officials across the region say the number of people dying of drug overdoses is directly related to the increased use of fentanyl, a drug that's 100 times more powerful than morphine. Carfentanil is its more deadly relative, more than 100 times stronger than fentanyl, and used to tranquilize elephants, and even, as you mentioned, in chemical warfare. Now, local health officials are hoping a new law in China will help to fight the opioid epidemic here in Western New York.
It's really everywhere. Drugs are being distributed all over Western New York.
Dr. Joshua Lynch is an emergency physician for Kaleida and ECMC. He's referring to fentanyl and its far more deadly chemical relative, carfentanil. It's showing up on the streets of Western New York in local emergency rooms and increasingly at the county morgue.
It's so concentrated that it's meant to treat a 500, 600, 700 pound animal. A handful of those grains of sand is enough to have somebody go unconscious and or stop breathing. Everybody's body's different, but the bottom line, it doesn't take very much.
As of March 1st, however, shipments to places like Buffalo or other parts of the country could be curbed after a new law in China takes effect, outlawing carfentanil and 3 other deadly synthetic opioids. China
is theoretically one source. Unfortunately, it's not the only source, but I would hope that if we cut off one major source, that we would directly see effects here.
As the local death toll rises, medical professionals like Lynch, who's also on the county's opiate task force, are faced with trying to aim at a moving target and one that's killing people at record rates.
It solidifies the fact that what we're doing is important and we have less time.
Because of the strength of drugs like fentanyl and carfentanil, stronger recommendations are being issued to local ERs for their use of Narcan, the anti-opiate drug that's the main reason that local OD numbers aren't higher than they are.
We've kind of issued new recommendations to all the people now who carry naloxone. EMS, police, fire, the public. We're instructing them to give a couple doses, not all at once, but a couple minutes apart if you don't see an effect.
Now, those new regulations that Dr. Lynch just mentioned are important, as is the addiction hotline that's run by the Opiate Task Force. It's often the first step for drug users or their friends and family to get help. You could be linked with an entire web of people whose only job is to treat the disease of addiction. That number, as you see on your screen, 716-831-7007. Live in the studio, Dave Graber, News 4 at 5:30.